Good afternoon, everyone. This video will be covering a specific disease that targets the human body's immune system. Your immune system is the body's ability to fight off viruses, bacteria, and anything that may be harmful to you, overall keeping the human body healthy. But this disease that we're going to talk about today directly hinders the body's ability to fight off viruses and bacteria. Today we will talk about HIV, what it is, and its effects on the human body's immune system. So by now you must be asking, what is HIV? So, HIV is a sexually contracted disease that is highly contagious. Once it infects the body, it directly attacks the host's immune system by attacking CD4 cells, also known as T helper cells. CD4 cells are white blood cells that coordinate the immune system's response to fight off infections and pathogens within the body, meaning that a person who has contracted HIV can't fight off illnesses like a normal person can, due to their immune system having a harder time detecting, responding, and acting against sicknesses within the body. Now, there are medications that help rebuild the immune system and stop HIV cells within the body from multiplying, effectively halting the progression of the virus and weakening it to a degree where the infected person can't even transmit the disease anymore, as long as he or she continues taking antiretroviral therapy. But this isn't a cure. Once an infected host stops using the medication, the HIV virus goes right back to destroying CD4 cells and weakening the immune system. While there is a way to live with HIV, there is no cure if you contract HIV. You will have it for the rest of your life. There is no going back. So now, in case you are wondering, there are different stages of HIV, three to be exact. There are three different stages of HIV, and each stage further progresses the virus's grip on your body's immune system. Stage 1 is often called acute HIV infection or acute retroviral syndrome. And this stage of the virus, your body has just recently contracted a disease, and HIV cells are replicating rapidly through your body, spreading and attacking T helper cells, hindering your body's ability to fight off infections. Now, some symptoms of stage 1 HIV are flu like symptoms, such as chills, night sweats, headaches, sore throat, rashes on the skin, as well as muscle aches, fevers, and ulcers on the mouth and genital regions. This is typically when you want to see a doctor if you're experiencing such symptoms. That way, you can start medication before the virus fully progresses. So, if you're having headaches, stage 2 is also known as chronic HIV infection or asymptomatic HIV. This stage of the virus can last up to 15 years, and some people don't even experience symptoms. People can have stage 2 HIV for years and not know they have it unless they get tested. In this stage of the virus, it replicates at a low level, slowly but drastically dropping the count of T helper cells within the body until the number of T helper cells in the body drops below 200. Typically, once the immune system's number of T helper cells falls below 200, that's when it advances to the third and final stage of HIV. So, before we go to the third and final stage of HIV, let's look at how stage 2, also known as asymptomatic HIV, can live in the human body for 15 years undetected without getting tested. 15 years attacking and eating away at the immune system untouched by killing off CD4 cells. And since the CD4 cells are dying off, the immune system can't react to the HIV cells in the body because the CD4 cells, T helper cells, coordinate the immune system's response to fight off the infections. Without the coordinators, how is the body going to fight back against it? Stage 3 HIV, also known as AIDS, which means acquired immunodeficiency syndrome. The virus typically advances this far once the body's CD4 cell count drops below 200, or the body falls victim to another disease while it was vulnerable in the other two stages. Diseases such as Kaposi sarcoma, a cancer within the blood vessels, or a strand of herpes called cytomegalovirus that affects the lungs and eyes. The immune system is so weak at this stage, the life expectancy for someone with full blown AIDS is less than 3 years. On contrast, for someone with stage 2, they can live up to 15 years not even knowing that they're sick. Antiretroviral therapy, also known as ART, can reverse full-blown AIDS back into stage 2 HIV, but it still can't cure it. It can only prolong your life and hold off the inevitable progression to AIDS. This shows just how important the immune system is to the body. Imagine not being able to fight off a simple cold or a flu strain, or have to live life on medication because you can't fight off infections or pathogens like a normal person. The immune system is an amazing part of the human body that is used in everyday life, even when you're not feeling sick or even aware that the risk of illness is around. Every day that you wake up healthy is thanks to your immune system always fighting off any sicknesses that you may come in contact with, whether you're aware of it or not. And the next time you have a headache, ask yourself, is it really just a Thank you. This concludes my video on a disease that affects the immune system and just how important the immune system is to the human body.